My name is Rick Swartz. I'm a stroke neurologist and clinician scientist, and I work at Sunnybrook Hospital in Toronto, affiliated with the University of Toronto. And I'm also the principal investigator for ONDRI, the Ontario Neurodegenerative Disease Research Initiative. This is a multidisciplinary, large program that goes across Ontario and has investigators at institutes across Ontario that includes both clinicians and primary researchers joining together to try to understand neurodegenerative diseases, how they differ, how they overlap, how to identify them, and hopefully how to build interventions for them. ONDRI is funded by the Ontario Brain Institute, also known as OBI. OBI is funded by the provincial government and really has as its mission the idea to advance neuroscience in the areas of care, research, and commercialization, and really integrating research in a new way across what they call IDPs, Integrated Discovery Programs. And ONDRI is one of several IDPs that is supported by the Ontario Brain Institute and that works with the OBI to achieve kind of this mission of advancing research, improving care, and driving industry commercialization in the areas of neuroscience. Embedding research and care is the direction and I think really the future of neuroscience, and it's what we need to do to advance care. And partnering with primary care is going to be vital for that, especially in the area of neurodegeneration. More and more research and clinical trial interventions are hoping to move to earlier stages of disease. One of the challenges that we have in neurodegeneration is once it's really become advanced, it's very difficult to reverse. And it may be easier to intervene and prevent the aggregation of amyloid and tau and other pathologies, prevent neurodegeneration, prevent the loss of brain cells. Once those brain cells are gone, it's much harder. And so end-stage disease is becoming less and less the target. Either early symptomatic or even pre-symptomatic disease is more and more the target. And we want to be able to prevent the disease from ever happening in an ideal world. In Ontario especially, the way to do that is to reach patients and families in the community, either directly and or embedded into primary care. And the MINT clinics are ideal collaborators for this kind of approach. The integration with academic centers for specific patients and the idea of facilitating care where people live in their homes is really what ONDRI and OBI are very supportive of. And what we want to do is figure out how to develop these research and care partnerships that can help facilitate care even in the research we do and help facilitate discovery at the same time. ONDRI has been doing a lot of really exciting work. In the first phase, it was a really detailed biomarker exercise where we're trying to understand why and how different diseases are similar and differ, markers of disease, but also markers of stability, markers of decline, but markers of function. And we really had a very detailed process where we advanced platforms of standard data collection on all sorts of different areas to allow us to dig deep into the causes of neurodegeneration. In the current phase of ONDRI, we're looking at moving that into the real world, moving that into the clinic, moving that into the community. And so we're building these toolboxes that will allow us to develop exciting, pragmatic, and impactful community-based research as well. We have several different aims in our current version of ONDRI. The first is to continue to mine the science and to actually make the best use of the volunteer time that our patients and family members provided. The second is what we call ONDRI at home, where we're building toolboxes and methods of evaluating patients in their natural lives, in their regular environments. So we're measuring gait and balance function, we're measuring sleep and activity, we're measuring social interactivity, we're measuring semantic content of conversations, we're measuring cardiac function in a non-invasive, practical and feasible way that persons with dementia or even elderly patients without dementia can tolerate. We're building the pipelines to make this standardized and to actually handle the mountains of data that can be produced by even using something like a wearable for a week at a time. And we're building interactions with our initial detailed biomarkers, but also in Ontario with our healthcare system. And so our third aim is validating our findings in other cohorts and collaborating with other people around the world But our fourth aim is actually built specifically to integrate with the first three, and that's health services research. And so we're connecting our work and our data and the BrainCode database, which is where we store all of the information collected in Andri. We are linking that and building pipelines to connect it to health services data held at the Institute for Clinical and Evaluative Sciences. This includes all the health administrative data for the province of Ontario. So we can not only collect feasible data for patients in their environments, in their homes, in their communities, we can also use their clinical work, their clinical interactions with doctors, with hospitals, to help us understand how they're functioning on a day-to-day basis and whether they're running into trouble. And this opens the door to identifying, for example, risk factors for falls or aspiration. This opens the door to potentially being able to tell when patients may be starting to decline long before it becomes obvious from a functional perspective. And it also opens the door to monitoring people for intervention and therapy in a whole different way. Our goal is to start to build these pipelines and integrate these processes so that we can provide tools that actually give feedback to patients and to clinicians that help with their care, while we're also collecting data to help accelerate research findings. That's what we're really most excited about in what Andri is now. If you're interested in learning more about Andri, we'd love to hear from you. There's our website, and there's multiple ways to contact us listed below. In conclusion, we want to thank the Ontario Brain Institute for their support. I'd like to thank Dr. Lee for the opportunity to present today, and thank you very much for your attention.